Hello and welcome to What is Cranio Therapy. I am very excited to be here with you to present a topic which is very near and dear to my heart. I represent Jagannath University Jaipur on behalf of HCAP. I am hoping that I am about to present today will pique your interest. Let's begin with the topic. Firstly, by defining what is craniosacral therapy. Craniosacral therapy is a light touch hands on therapy enhances body natural capacity for healing. Or you can say craniosacral therapy is very gentle, non invasive therapy that modifies and corrects restriction in craniosacral system and body systems to improve wellness and enhance body self correction regulation mechanism. For 30 years, craniosacral therapy has shown to be effective in treatment of a wide range of physiological issues associated with pain, loss of biomechanical, systemic, and emotional function and well being. Craniosacral therapy is useful as a primary treatment method and in combination with other traditional physiotherapy or complementary therapeutic techniques. It is based on the dura membrane, which includes spinal cord, dura membrane, bony ligamentous structures, cerebrospinal fluid. One of the interesting thing about the craniosacral system that it has its own independent rhythm and its cycle is about 6 to 10 cycles per minute. It is a subtle physiological response throughout the fascia of the body to normal fluctuations and production and reabsorption of cerebrospinal fluid. So, our body innately makes cerebrospinal fluids, circulates it, and reabsorbs it. The craniosacral therapy practitioners easily encourages the body to release restriction, that is, it has been unable to overcome it on its own, rather than deciding how these changes should be made. The therapist follows the body's response as to how to proceed. Following this gentle approach helps ensure the method is safe and effective. Because there is a cycle and fluctuation of pressure, just minutely, we can feel that as a therapist throughout the entire body, and it helps us learn where there might be fascial or musculoskeletal restrictions. When we do find those inconsistency and how the body responds to subtle changes in pressure, it helps us to find areas of restriction that can be released. Those restrictions that are bound found tend to hang on and disrupt CNS or central nervous system functions. So our job is to try and find those restrictions, release them, and let the central nervous system do the work its intent to do when it has freedom to do it. One of the really important structure that we work with craniosacral therapy is dural system, which is the three-layer connective tissue surrounding brain and spinal cord. Most of you probably know about the dura, but it has just to go a little bit further into it. The tougher parts of dura are primarily collagen, so the outer layer is collagen, the arachnoid trabeculae are collagen, pia layer is also made of collagen, but they are of a lot of different densities and functions. They are very important to our central nervous system, and we have interruption in within the dura. We have problems with the central nervous system. The laxity in this system can cause impairment of self-monitoring and regulation of autonomic nervous system, impaired brain function due to lack of physical support for central nervous system. So craniosacral therapy evaluates and addresses restriction in the craniosacral system. As we talked earlier, the craniosacral system consists of membranes and fluids that surrounds and protect the brain and spinal cord as well as attached bones. These membranes extend from the bones of skull, face, mouth, and down the spine to the sacrum to or tailbone area. This craniosacral system plays a vital role in maintaining the environment in which the central nervous system functions. The central nervous system monitors and responds to everything which is happening in the body. Since the brain and spinal cord are contained within the craniosacral system, it is easy to see how it is powerful influence over a wide variety of bodily functions. So just touch on that the function of some of the structures of dura around brain itself in shunt in the skull is to provide an atmosphere or environment where the brain can float. It not supposed to be sitting on the top of or resting on. The skull itself it is floating there, so you can imagine if everything is lax, if those division in the brain which are made up of collagen part of the dural system have any laxity in them, the brain is no longer floating. Once that happens, the brain can become impaired. Its fluctuation can become impaired. So, moving into detrimental intracranial pressures, changes due to poor integrity or loss of that float results increased concussion syndrome. So, if we are lax inside system and we take any kind of impact, it doesn't have to be head injury, can be kind of a vibrational injury. So, this is how a craniosacral system is made up of. It includes meninges, cerebrospinal fluid, bones, vertebrae, and the floating brain, which is being covered by cerebrospinal fluid. So, if this dura isn't very strong, we can have an increased cerebrospinal fluid leaks or dural where the dura is just too stretchy and it allows CSF to pool in lower part of CNS. The arachnoid trabeculae can collapse under some circumstances. So that space where the arachnoid trabeculae are is where the CSF is. So if we have areas in that space where it is collapsed, that CSF move around and impairment of our nervous system happens. The therapist follow few basic steps in craniosacral therapy. Firstly, the body has capacity and knowledge to heal itself. We trust in body wisdom. We use craniosacral rhythm and clues in facial tendal membrane. Fascia is also a collagen. So we do not treat any disorders or syndromes. Treatment sessions are very relaxing. You can stay close. So craniosacral therapy frees up tissues in the and around craniosacral system to enhance the flow of cerebrospinal fluid. CSF nourishes, protects, cleanses the central nervous system, enhances nerve conductivity. Improved flow of CSF provides the body with resources following it to be better perform and when necessary to heal and restore function to a better balanced state because it enhances the body's natural healing processes. Said craniosacral therapy is increasingly used as a preventive health measure. It has the ability to sustain a healthy immune system and bolster resistance to disease. It also promotes relaxation by calming the autonomic nervous system, the high alert system that controls fight and flight responses. Good health can be compromised by external factors but also by hormones and chemicals released naturally by body while coping up with the disease and stresses of life. Craniosacral therapy improves inner health and gives a sense of well being. Craniosacral therapists use finely tuned palpation skills which are unique in working to tune in with the body's natural rhythm while respecting clients' individualism. So, we are looking for a place of ease for that tissue to be not one of the restriction or tension. We allow the body to guide us into that position, and her hands help facilitate body's desire to be there. So, we are going to discuss overview of it. That what is craniosacral therapy? It is a type of body work that relieves compression in the bones of head, sacrum, and spinal cord. Craniosacral therapy is non invasive. It uses gentle pressure on the head, neck, back to relieve stress and pain caused by compression. It can, as a result, help to treat a number of conditions. It's thought that through the gentle manipulations of the bone in skull, spine, pelvis, flow of CSF in the central nervous system can be normalized. This removes blockage from the normal flow, which can enhances the body's ability to heal. Many massage therapists, physical therapists, osteopaths, chiropractors are able to perform craniosacral therapy. It can be part of an already scheduled treatment visit or sole purpose for appointments. Craniosacral therapy benefits between 3 to 10 sessions. Craniosacral therapy clears restriction in the facial tissues of the body. These are soft tissue layers that are continuous throughout the whole body and envelop every organ, muscle, and bone down to the individual cells. As a light, hands on approach, CST harmonizes with the body's natural hydraulic forces and movements, thus encouraging and enhancing the body's inherent natural healing abilities. This gentle releasing of chronic tension within the body can effect major changes in the both physical and emotional well-being. This is what autonomic nervous system works. So we are going to discuss what are the benefits and uses of craniosacral therapy. CST is though to relieve thought to relieve compression in head, neck and back. This can soothe pain, release both emotional and physical stress, tension. It's also thought to help restore cranial mobility and ease or release restriction of head, neck and nerves. Craniosacral therapy can be used for people of all ages. It may be a part of treatment conditions like migraines, headaches, constipation, irritable bowel syndrome. Disturbed sleep cycles and insomnia, scoliosis, sinus infections, neck pain, fibromyalgia, recurrent ear infection, or colic infants. Temporomandibular joint pain, trauma recovery, including whiplash injuries, anxiety, depressions, or difficult pregnancy. There are plenty of anecdotal evidence that craniosacral therapy is an effective treatment, but more research is needed to scientifically determine this. We are going to discuss what are the side effects and contraindications for craniosacral therapy. The most common side effect of craniosacral therapy are severe or the mild discomfort following the treatment. This is often temporary and will fade within 24 hours. There are certain individuals who should not use craniosacral therapy like hypertensive patients, severe bleeding disorders, aneurysm, recent traumatic head injuries. So now we are going to discuss procedure and technique for the craniosacral therapy. When a patient arrives for appointment, then the therapist will ask about his or her symptoms and pre-existing condition that he or she gave. Now patiently typically remain fully clothed during the treatment, so wear comfortable clothing during appointment, and patient will lie down on his or her back on massage table. The practitioner therapist may begin at head, feet or near middle of the body. This is a picture in which OC1 and frontal technique is being shown. A part of skull or back that muscles goes from part of skull to little section of hyoid bone. Technically, it would be a OCB1 releases, which is occipital base release. It is right OC, occipital base, whose occipital C1 releasing many of his have cranio-cervical instability. We have often find that occiput and C1 jammed together and not free to move. Occiput is meant to glide on beveled surface of C1 so that we can turn our head and take impact. Our body need to able to move, so our body is designed to take impact or change position. But often times when we have compact of occiput to C1 and that bewailing surfaces is jammed and not moving, we have lot of pain and discomfort, headache, brain fog, a lot of things you guys experience which is also experienced in regular positions. There is number of steps that is done in particular placement. First step is just sort of soften the tissue there, and these are suboccipital muscles which can become very tight. Put person at platform, lifting left on C1 to allow the occiput to glide away from it. Next step is to bring little bit of instance and minor bit of traction between C1 and occiput. Next step after that is actually do spreading, a myofascial spreading, which helps to open foramen magnum, which that space where people carry cerebral tonsils herniate through. So if we can open that space a little bit, it can relieve some of pressures and carry. Then we do little tiny bit of traction down the dural tube, which is called dura, that sounds the spinal cord, surrounds the spinal cord itself, and we have intracranial dura, which is dura around brain. So frontal release, this pressure are very light. We are using 5 grams of pressure, the weight which is a weight of nickel. The provider will gently hold the patient feet, head or sacrum to listen their subtle rhythm. It, if they detect it's needed, they may be gently press or reposition to normalize the flow of CSF. They may use tissue released methods while supporting one of the patient's limb. During the treatment, some people experience different sensations. These may include feeling deep relaxation, falling asleep, seeing colors, seeing pulsations, sensing pulsations, having pins and needle sensation, hot or cold sensations. So craniosacral therapy may be able to provide relief for certain condition, with the strongest evidence supporting it is as a treatment for conditions like headaches. Because there is a low risk for side effects, some people may prefer this position for medication that comes with more risks. Here I am sharing some videos for technique demonstration how it works. These are the references which I have been taken.